Hello, everybody. It's a pleasure for me to welcome you all. This is a short video which was recorded during the ACR 2021. We just finished an exciting mentor-mentee meeting with Professor Peter Merkel, such a reputable guest in the field of vasculitis. And hi, Dr. Merkel.
Hello.
Thank you for being here. I'm Alvise Berti from Trento, and I'm here with Mert Oztas from Istanbul University.
Hello.
So we are here to interview Dr. Peter Merkel, and so let's start with a question. So what do you think about this mentor-mentee meeting organized by EMEUNET?
I thought it was excellent. I was not sure what it would be like, and I really enjoyed it. I hope the people who were taking part found it valuable. I found that it made me think myself about what do I do as a mentor and as a professor, and made me look back on my career path. So it was interesting for me to think about these issues as well. I hope that my experiences will help others as they try to craft their own careers.
So I'm sure you have been a mentor for for people and for a young researcher, but did you have already had the chance to do something like that, to be in a meeting with more mentees?
Yes, I've had some experience. I've been a mentor for many people over the years. I've had a long career, and that's been very satisfying part of my career is having mentees that I work with and help them develop their careers. I have done a few events where we talk about what it means to be a mentor or career development, but this was a different form, and I think the questions were excellent about sort of the pathway and what it takes. It's often, the meetings I've been on have often been, what do you need, what makes a good mentor? How do you pick one? Or certain career development steps. This was a little bit different, which I thought was interesting. So I think it was a little bit more of the pathway approach.
So you are like a legend in rheumatology and in vasculitis, let's be honest. So would you like to briefly introduce yourself and your background?
But nice of you. I'm not sure it's true, but it's nice of you. So I am Dr. Peter Merkel. I'm a professor of medicine and epidemiology at the University of Pennsylvania, Philadelphia in the United States, which is one of our largest biomedical institutions and educational institutions in the country. I am, for over 25 years, have studied vasculitis and scleroderma, where I practice medicine and clinical rheumatology in those two fields. And I run an international research network called the Vasculitis Clinical Research Consortium, which studies vasculitis. I've been principal investigator for multiple studies and grants, clinical trials, genomic studies, biomarker studies, outcome metric development, as well as similar work in clinical trial design and epidemiology in scleroderma. And I'm the chief of rheumatology at the University of Pennsylvania, so I have an administrative role as well. And I've had the opportunity to work with a great many wonderful collaborators, young and old, over the years. And that's been really fun and very rewarding.
Dr. Merkel, why did you choose a vasculitis field for your research? Can you explain briefly?
So I chose my work in vasculitis and scleroderma, and I do much more in vasculitis and scleroderma, but I do both. It's a combination of opportunity of being at an institution where that was seen a fair amount, and there were some clinical experts there I could learn from, and the fact that I like complex, unusual diseases. I enjoyed the challenge of difficult, serious diseases for patients. I wanted to be able to help them, and the diagnostic puzzle, the challenge of taking care of multi-system autoimmune diseases was appealing to me. And then you get, over your career, then you get into a situation where you're able to see more and more, and then you really feel like, I really like that. And so you build it over time. You don't wake up one day being an expert in vasculitis and scleroderma. You have to develop that skill. And I think you gravitate towards things you're interested with a whole dose of opportunity.
And so tell us more about your major projects right now. So we know that you are the director of the VCRC, the Vasculitis Clinical Research Consortium. And so how important is for your research this institution that you created? So how do you see it?
It's central to the work that I do, and so much of the work we have comes out of that. I am the co-principal investigator or principal investigator of multiple clinical trials we're conducting in ANCA-associated vasculitis, giant cell arteritis. Several trials we've just completed, some trials that either have recently been published or are about to be published. And then all of the data from those trials allow us to do other interesting investigations. We have these longitudinal studies where we follow patients for many years. We have biosamples, and those are very, very helpful, including tissue. We have a lot of genetic material. So create these opportunities for then to work with other collaborators and build out that. In scleroderma, I do work in clinical trial development and design, and that's also an outcome measure, and that's quite interesting. So the institutions, these networks are very important. Especially when you study rare diseases, you have to work with other people to develop enough to move forward. I also work with industry. I do work with the biopharmaceutical industry to develop drugs and other scientific offshoots of that. So that's been helpful. I get to work in other fields indirectly by advising people and mentoring people and seeing it put on. So I have my hand in some other things, but mostly I concentrate in these two areas.
And you also have a lot of collaborators and young collaborators, of course.
I do. I think, the secret to being successful is to find really smart younger people and help guide them and so they can make your work even better. An ideal mentee is someone who's eager, hardworking, and will take ideas you develop together to a better level. And so I think it's crucial to bring in young investigators in any field. People get on in their careers, they have other responsibilities and they can't devote the same amount of time sometimes to research. And we want new ideas and new areas. And that's been very helpful. I'm old enough to have my mentors now mentoring other people, which is very encouraging. Additionally, I have people who I've helped mentor who now I look to for their leadership in some of the projects.
Dr. Merkel, what were the major challenges to tackle in your early career, and what do you recommend to young researchers to deal with these major challenges during their career?
I think we're talking about research career. So if you're talking about a research career, probably the major challenge all people have is to have what we call protected time. How do you get time that is other than, how do you get time outside of the clinic? It's very important, I think, to be clinically active and to become an expert in the diseases you're studying. But if you're all the time in the clinic, you'll never have time to do research. So how do you have that protected time? Different institutions, different countries. The United States, that comes from funding, to be able to get grants that you have to write for and get money to be able to protect your salary for that time. In other countries, there's other ways. So having the protected time and then having the right number of projects that can become fruitful, maybe in the short term, maybe a medium, and maybe a longer term one, that type of thing. But the challenges are getting yourself situated so that you create, whether it's in the lab or in clinical research, you have to generate data, you have to generate enough so that you can use that to publish and to do more work. So I think it's, and it takes time. And so you have to be patient, which is hard, and you have to build it up. Hopefully you'll have help. I don't think we do any things without working together and help.
So during the meeting, we talk a little bit about which kind of skills needs to be developed from the mentees. And you talk a little bit about writing and preparing the presentation. So not only being good in what you do, in research, but also be able to communicate and to kind of promote, in the sense, the research you are doing. So can you elaborate a little bit about it?
I think I think it's really important to gain skills in medical writing because you want to be able to, it's not just to promote yourself, but because you want to put your work in to send it, to put it in the right context. Proper writing is also proper thinking. And so I think if you can't put it in writing, then maybe you don't completely understand what you're studying. So there's a matter of outlining it and being able to write your ideas, but also to report them in a paper. It's really important to write well so that you get better at communicating. You'll publish better, and you'll be able to write your grants better. And the secret, I think, to writing, as I said, is rewriting, is taking your own work, putting it aside, and 2 days later bringing it up and saying, what can I make better? People try to rush it. It takes time, whether it's a paper or a grant or an abstract or a review. It takes more time than you think. And the presentations, again, it's not just you want to look good and have all the fancy graphics. You want to think about the project. What are the key elements to you have to know them so you can tell them to others. And I think it makes me a better investigator when I can think about my own project and present it in a better way. And I think people should spend time thinking about those things. I think it's particularly challenging at international meetings because it tends to be mostly in English, which is a great advantage to some of us who are native English speakers. It's hard for others. So I recognize that challenge and I admire people who can do that. But I think it's important to be able to communicate well. And I think you will find that working on your communications will always help in various stages of your career. You'll get your point across. You'll write a better application. You will explain things to people better.
So the final question, so how did you see the research on vasculitis in the next years? And how pandemic may have changed the way in which this research is conducted?
I'll take the first question, the second question first. Pandemic has obviously affected every aspect of medicine and our lives, almost, I think, for the last 20 months or whatever. It's been, first of all, it puts it into context. We've got millions of people dying. We've got people who are sick. Their lives are disrupted, economies. We have to put that into context. We have our colleagues, or you are working very hard to, in the hospital and keeping things going. Clinical and translational and laboratory research, all of it was either shut down or tremendously limited because of the pandemic. So people have, especially young people, have lost time in their careers. That is a problem. We need to figure out how to help give them more time to catch up. I'm worried about that. That's a concern. From a research standpoint, seeing patients, recruitment was down. We did a lot of online work. We were able to change to telemedicine. We're on here for Zoom. We were doing, and we're still doing, visits with patients. That, for research, for some research, that works. If you want to collect their peripheral blood mononuclear cells, that's very difficult with the iPhone. Even if you get a good app, it's hard to get the T cells. So it does vary, but we've been able to do some of it online. So I think the delay is real. So I think it's been a challenge. We should recognize that. If you look at the last EULAR and the last ACR, there were just fewer papers because the production was down. I hope to see it change. Your first question?
It was about how did you see the research in vasculitis in the next years?
So, there's never been more research in vasculitis in the world than there is now. There's just a tremendous number of, and people like to focus on the trials because they're interesting and they are immediately approachable. But there's a lot of really good work being done in genomics and in biomarkers and in understanding how to measure disease and in laboratory, physiology and molecular biology and informatics. I think we're learning more about the diseases. We're going to be doing more personalized precision medicine as we move forward. There are still many forms of vasculitis we don't have very good treatments for. So there's a long way to go. We've done very well. Our patients are for many diseases, they're much better treated, but there's more to be done. I think we're going to continue to see collaborative research in rare diseases. And in rheumatology and immunology, we see a lot of rare diseases. And those groups that are able to work collaboratively, scleroderma, vasculitis, in other areas, are going to be more successful as we share ideas. More of the team science. You still need individual leaders, but it's good to collaborate.
Thank you. Thank you for this insightful discussion. It has been a pleasure to have you here, Dr. Merkel.
Hope that's been helpful. Thank you.
This has been recorded for the EMEUNET podcast following the meeting of the EMEUNET peer mentoring, mentor-mentee meeting. So thank you to EMEUNET for supporting this activity, and to our leader, Silvia Piantoni, coordinating the peer mentoring subcommittee. Thank you, everybody, for listening.
Thank you.
Goodbye.